And now it's my honor to introduce our speakers for the annual Innovation in Pharmacy Lecture. This year's lecture is delivered by Dr. Patricia Cook, and I'm Chief Medical Officer at Daily Planet, and Dr. Kelly Goode, Chief Pharmacist at Daily Planet Health Services, and also former APHA President. During the lecture, listeners can submit questions via Zoom, and Patricia and or Kelly will answer them in a short question and answer session that we have at the end. The title of their lecture is Connecting the Dots, Innovation in Pharmacist Services. Please welcome Patricia Cook and Kelly Goode.
Okay, so in all full disclosure, Dr. Goode wrote more of this than I did, so I have to do more reading than she does, but she always speaks well for me. So we are absolutely delighted to have the opportunity to speak to you this afternoon. I am Patricia Cook. I'm the Chief Medical Officer at Daily Planet Health Services. I'll be presenting today along with Kelly Goode, who is a community-based pharmacist practitioner at Daily Planet Health Services and the professor and director of the community-based pharmacy residency program at Virginia Commonwealth University. Today, we are going to share our experiences with connecting the dots, innovation in pharmacist services. So what is innovation? I'm going to give you the clicker so you can do the slides. An easy question. Maybe, but we continue to struggle in pharmacy and in healthcare, stumbling over making ideas happen, solving problems, implementing new services, and doing it profitably, or at least with a documented positive impact. Steve Jobs inspired the 2005 Stanford graduates with this quote during his commencement address: "You can't connect the dots looking forward. You can only connect them looking backwards. So you have to trust that the dots will somehow connect in your future." In the spirit of Apple and others, Peter Fisk defines innovation as connecting the dots, the ones the other ones miss. At Daily Planet, we will begin our story by first disagreeing with Mr. Jobs and describe how we connected the dots moving forward through innovation, with disagreeing with him and describe how we connect the dots moving forward through innovation in pharmacist services. However, it does begin with connecting the dots and taking a look backwards at our Daily Planet history. So no, we are Daily Planet, but we are not a newspaper. Okay. In 1969, Daily Planet opened our doors, and Daily Planet was more of a social services agency at that point. So they were providing social supports to a generation of young people who were kind of, tuning in, dropping out, falling out of the mainstream of society, and they were beginning to struggle. They were very disenfranchised. So Daily Planet came in, and they offered shelter and meals and counseling and eventually health clinics to help integrate those folks back into society. And they surveyed the folks that they helped. And they said, it's time to name this organization. What do you want to call it? And the young people then were very attuned with Superman, and they said they felt like Clark Kent entering the telephone booth and transforming into Superman. And that is why they chose the name, the Daily Planet. So during the 80s and 90s, Daily Planet began to transition more as we started to realize that the way social determinants of health impact healthcare in general, right? So that the two are linked, that you need food, you need shelter, you need support, but you need all of that in order to be healthy. And in order to be healthy, you need all of those things. It's a bi-directional link. And so in the late 80s, we became one of the first healthcare for the homeless designees through HRSA. And we began to open clinics. So we opened a main clinic that has medical, behavioral health, case management, and dental all under one roof. And as the years went by, we opened more and more locations. So now we have a total of 10 clinics. 2 are those multidisciplinary type clinics. 1 provides services mostly in Spanish. 1 provides services more in English. We have 4 clinics that are embedded with other homeless service providers in shelters, and they provide both medical, behavioral health, and sometimes a little dental even at the shelters. And then we have a mobile medical unit, and we have what we call our open access clinic. So we have continued to grow in order to meet the needs of the folks around us. The other 2 sites that we have, if you were adding, I only got to 8. The last 2 are residential sites. So one of those is in connection with our local VA to provide shelter to vets who have coexisting serious mental illness and addiction problems. And then the other is our medical respite recuperative care shelter. And that's for people who are homeless that have had an acute hospitalization and are not well enough when they get discharged from the hospital to go back outside. So through our growth, we have become, in 2005 is when we started the partnership with the VCU School of Pharmacy. And Dr. Goode came on board way earlier than I did. I didn't get there until 2020. So she brought me in and helped me learn the Daily Planet way and the way to connect the dots for folks. So let's look going forward. Sorry, I can have trouble with the plug. There we go. Okay. So the reason we connect the dots at Daily Planet is for our patients. Our patients are the most important and at the center of everything we do. Our patients are the foundational dot. In fiscal year 2021, Daily Planet provided services to 9,277 patients. Now, that was during the pandemic. We did a lot of testing. We did a lot of vaccines. Our doors opened wider that year than they had ever opened before because the pandemic shone a light on the health inequities that were all around us that previously may have gone under the radar a little bit. Our patients pretty much all live below the 200% of the federal poverty level. And if you look at the numbers, it's like 80% of them are below 100% of the federal poverty level. 42% are uninsured, and that's usually because they're uninsurable due to citizenship status. 43% are insured with either Medicare or Medicaid, and we do have 13% that have private insurance. 28% of our patients prefer their healthcare services in Spanish. We have a growing number of patients now who are from Afghanistan, and so we are starting to figure out ways to provide some services in Dari and Pashto as well. 70% of our patients are homeless. And that is homeless using the HRSA definitions, which includes people who might be currently living in a shelter in a transitional housing situation or doubling up with relatives that would otherwise not have a place to live. 40% identify as Black, Indigenous, or people of color. We have conducted the Prepare Social Determinants of Health survey on about 600 of our patients so far. And that survey questions things that are social determinants of health, like education level, history of incarceration, threats of violence at home, income level, demographics, and it puts it all together in a score. The highest score you can get is 22. So that makes you the most vulnerable people out there, right? When you look at our population, 20% of our people hit a score higher than 15 when we give this scoring system. So as you all know, Superman had 2 sides, right? He puts on his cape, he has the ability to leap tall buildings in a single bound. And as mild-mannered Clark Kent, he goes about his daily duties as a reporter. The majority of our Daily Planet patients have difficulty in their daily duties. They have to manage multiple chronic medical conditions. They often are managing mental health and substance use conditions. They have to figure out where they're going to sleep tonight. They have to figure out if they need to get out of the elements tonight, if they're in physical danger from the people around them tonight. And they have to find their next food. So trying to provide healthcare to these folks, we have to get a little creative, right? So picture these real life patient scenarios. A patient who relies on Medicaid to provide transportation but has no address to give the Medicaid transportation service. A patient who has heart failure and needs to be on a diuretic but has no access to a restroom. A patient who needs to store insulin but has no refrigeration. a patient with diabetes who only gets their food at a food bank or a food feeding program where they have no control over the number of carbs that they're offered, no control over their sodium intake. Patients who do not speak English and can't navigate our referral systems or our healthcare systems, or even if they don't speak English and they have Medicaid, trying to call for Medicaid transportation, there's not actually a prompt to hit for another language. Some of those patients need treatment for hepatitis C, and you can't get your hepatitis C medicine delivered until you have a conversation with somebody from the specialty pharmacy, but they only speak English. So there are just barrier after barrier. And even our patients who are fortunate enough to have Part D coverage from Medicare, $100 copay is just astronomical and unattainable for most of our patients. So that brings us to our second dot, which is our team. And you've seen some of our team already. We have 156 superheroes that work at the Daily Planet. They help us provide primary care, behavioral health, dental, residential, and case management services, and health education, and pharmacy services. And all of the services are delivered in a very holistic way. So if you get one of us, you get all of us when you come in the door. You have access. Once you've gotten in the door, you have the whole team of people working together to get you healthy. There's the outreach team who goes out of the building to find people in encampments and sleeping in the woods, and who stayed out until midnight last week when the remnants of Hurricane Ian were supposed to hit Richmond, because they had a last minute donation of blankets and tarps they could give out. We have our health educator, Leah, that you heard from in the video, who cooks everybody's favorite dishes at Diabetes Impact Lunch every Thursday. To quote one of our patients, that Miss Leah is the best cooker ever. We have our front desk staff who's willing to sit there when the Medicaid transportation or the Uber doesn't show up, and the patient's there for a couple hours after clinic closes waiting for a ride. We have folks who deliver things. We have people who go and get medicines for people. We have people who go and get supplies for people and then take them to the shelter to give them to the person because there's no way to meet up anywhere else. And we have a pharmacist who, on her way out every Friday, will stop and see the gentleman in the parking lot and inject his Trulicity for him so that he will continue to have better control over his diabetes. Our team and our patients represent the foundation for innovation and connecting the dots and improving the quality of healthcare through medication use. How did we build pharmacist service innovation by connecting the dots? Well, we're going to share the top 5 dots that we connected. I'm going to turn it over.
If I can get this to work.
Are we pointing the right way?
All right,
Okay.
there we go. Yeah. So our first dot to connect is build on what you do day in and day out. Sir Richard Branson, founder of the Virgin Group, also defines innovation as A plus B plus C plus D. Always be connecting the dots, which is not about creating newness, but making sense of what you have that can be shaped in new and interesting ways. As pharmacists and healthcare providers, we spend much of our time collecting the dots, seeking new insights, getting more training, generating more ideas, but too little time connecting the dots. In the United States, 75 cents out of every healthcare dollar goes to treat chronic disease. What do we treat chronic disease with? Medications. As the medication experts on the team, pharmacists can impact patient outcomes through ensuring access to the best medications for patients. Build on what you do day in and day out. Through grant funding from the Virginia Healthcare Foundation, Daily Planet's pharmacy technician, Pam Mentor, serves as our medication assistance program coordinator, has accessed more than $23 million of free medications for our patients since 2016. This includes access to standard of care medication for diabetes and other high-cost medications. Furthermore, as a 340B entity, the Daily Planet contracts with 2 community pharmacies to provide lower cost medications to patients who are uninsured. Other programs that increase access to medications include a partnership with the Contraceptive Initiative, Access Initiative, which funded $130,000 to provide long-acting contraceptives, reversible contraceptives in Depo-Provera. Since 2021, Daily Planet has provided contraceptive services, including access for 363 patients. Another example is the partnership with the Virginia Department of Health, which provided funding for tobacco cessation products for our patients trying to quit smoking. And in the true spirit of connecting the dots, Daily Planet will pay for medication for patients who are unable to pay. For patients on the street who cannot store refrigerated medication, Daily Planet stores these medications for patients. And our next adventure in connecting the dots, which we're really excited about, will be our very own 340B pharmacy at our West Grace Center. Beyond medication access, pharmacists help simplify medication regimens. Our behavioral health pharmacist, Dr. Sharon Gatewood, who recently worked with a patient who suffered a stroke and was struggling with increased medications. In addition, the patient had short-term memory loss and excess emotions as a result of her stroke. Her husband was trying his very best to be an excellent caregiver by helping her with her medications and getting them all filled on time. But it was just overwhelming to both of them, all complicated by COVID-19 and not feeling comfortable coming to clinic. The behavioral health pharmacists worked with the patient through telehealth. Medications were deprescribed and the patient was transitioned to a pharmacy with adherence packaging and medication synchronization. Result, patient and caregiver were feeling better and more confident and empowered to deal with their chronic conditions. Build on what you do day in and day out to connect the dots.
So innovation is the combination of all the little things you do day in and day out. And when these actions are completed thoughtfully and intentionally, they begin to form the energy, direction, and purpose that allow you to connect to dot number 2, raise your hand. The first day for one of the pharmacists at Daily Planet in 2010 was the same day as the new chief medical officer in 2010. This is not me. And the chief medical officer said to the pharmacist, "I'm not sure what to do with you." And her last comment when that chief medical officer left the organization was, "I never want to practice without a pharmacist again." Now, see, had it been me, I trained at an institution where we had pharmacists on our teams, and I would have known from the beginning I didn't want to practice without one. I was given a gift, right? Innovation was built on raising a hand and offering to help in any way necessary to meet the needs of patients. Sometimes it means not always doing what you want to do, but by doing what needs to be done. In other words, leading from where you stand. An unbelievable number of prior authorizations are faxed to our clinic every day. Paperwork, denials, peer-to-peers, appeals, endless minutes on the phone, not really what we want to do at all, but it needs to be done. So hand raised, the pharmacist and the pharmacy technicians facilitate that prior authorization process for medications. They have even provided education to our provider team on how to use pharmacy speak to get those authorizations done. We know about RX bin numbers. We know a little bit about, what the pharmacist needs now. Also improving medication access, pharmacists have helped lead the implementation of our continuous glucose monitoring access for our patients. So here's a great story. This is Mr. W. He's in a wheelchair because he has a below the knee amputation on the right and uncontrolled diabetes. He was having difficulty navigating the process to obtain his prosthesis. It had been over a year since his amputation. He had an active prescription out there to get this prosthesis and just couldn't get from point A to point B to get it and then to see the therapist that was going to approve it and make sure it fit. He also couldn't navigate his diabetes very well. His A1C was always over 11. It just was always high. He didn't believe that checking his blood sugar didn't really make sense to him because he has some literacy barriers. And so the idea of this cloud of numbers that we ask people to try to navigate in their mind, oh, you're high, oh, you're low, you're high in the morning, you're low at night, was just one step too far. So he would just go by how he felt. And he had a regimen that was, long acting insulin plus 3 short acting insulin injections throughout the day. So whatever he felt like he was high, he'd take one of those insulins, and whenever he felt like he wasn't, he wouldn't. And you never knew if it was long acting or short acting because he had some trouble telling the difference. Pepsi is his favorite drink. That would always help. If he was low, he'd just have a 2-liter. But he was convinced that didn't actually increase his blood sugar at all. And he never tested. So we were able to simplify his regimen, and we started him on a once-weekly medication. And the bigger thing that we did is we empowered him with continuous glucose monitoring, and he began to get control over his care. So that red line is his A1C over the course of, that's just 1 year, but it had been many years. You can see the red line never hit the gold blue line until we did the CGM. And this last visit, his A1C was 7.5. And he credits it and he says, somebody listened to me. Somebody took the time to find out what was going on. And I figured out how to control this. That's what making healthcare better with medication use. That's what does that. So Daily Planet early on was not giving vaccines to patients. So pharmacists raised their hands again, and they accept leadership responsibility for building our vaccine for adults and vaccine for children programs. We now have 3 sites that have VFA and 2 sites that have VFC. And since December of 2020, Daily Planet has administered over 2,500 routine vaccines and over 2,100 flu vaccines to both pediatric and adult patients. The success of our VFC and VFA programs led us to be the first place that the Richmond Henrico Health Department decided to give COVID vaccine. So on December 23rd, 2020, I got the delivery of the box and everybody in the clinic cheered as we brought the box to the back. And on the 24th, we hosted other safety net clinics to come into our space when we closed down for patient care, and we vaccinated 400 safety net providers in those first 2 weeks of COVID vaccine being available to us. Then we hit the road because the next, in Virginia, the next eligible group in one of the early groups was people who were homeless, people who worked in homeless shelters. So we went to 27 different locations because at that time there was emergency shelters set up at 11 different hotels in and around the city. Plus we had our usual shelter system. And we did vaccine events in all of those places, in hotel breakfast bars, in outside parking lots, underneath tents, and in our one of our buildings that we had acquired just when the pandemic started, that really the only thing we'd done is change the floor. We hadn't done any kind of renovation to this building. So we hung shower curtains from the ceiling for people to sit slightly separate from somebody next to them while they were getting their vaccines. And we could run 150 people through that vaccine clinic easily in a half day. So a total 14,438 vaccines since the December of 2020. We've also now been giving monkeypox vaccine and recently been giving more and more pediatric catch-up vaccines. In 2017, Daily Planet started an office-based opioid treatment program and became a preferred OBOT in the state of Virginia. It's a multidisciplinary program. It has behavioral health clinicians. It has peer recovery specialists. It has our prescribers, who in our case are psychiatrists and psychiatric nurse practitioners. It's a case manager, and it has a pharmacist, Sharon. And the whole point, obviously, this was in response to the opioid crisis. That was another pandemic, and it continued on through the COVID pandemic, as we all know, and the overdose deaths have continued to rise. So we've shifted more now to a harm reduction strategy. We're doing Revive training for all the people that come into the clinic. We are distributing Narcan through an agreement with VDH. Sharon's managing a lot of that. And as the treatments grew and evolved and we were able to go from Suboxone to Sublocade, Sharon has managed the Sublocade program. She raised her hand and she developed a protocol and she developed procedures and she incorporated the use of Sublocade in our medication assistance treatment program. She helps with the ordering, the prior auths, the administration of the medication to patients, and working with the prescribers to manage and taper when needed. She had a patient who was on Suboxone that was referred to her to start Sublocade. And after 2 years on Sublocade, the patient decided to taper off, and Sharon helped develop the taper and provided that patient support. And now we have that patient in remission, successfully off of Sublocade and Suboxone. Since 2010, our pharmacists have conducted over 17,000 patient appointments. 500 patients per year receive medication-related services from pharmacists. In 2021, they've had 841 visits, which do not include any of the immunization visits. Our pharmacy team raises their hand. They raise their hand all the time.
So where will raising your hand lead? It leads you to dot number 3, practice your values. At Daily Planet, this means building relationships through respect, inclusiveness, empowerment, and compassion. Raising the pharmacist's hand led to trust, respect, and time together with the previous chief medical officer, grounded with building our relationship in the creation of Diabetes Impact. The Diabetes Impact program started in September 2011 with funding from the American Pharmacists Association Foundation. We are ever so grateful. Since then, 710 patients have participated, with 317 patients currently enrolled. And in 2022, 780 diabetes impact encounters so far. The program has evolved over the years, but the core components to that team approach with that of self-management, with that patient at the center. The patient visit structure is very unique in that the prescriber, currently Dr. Cook, and I see the patient jointly at the same time in the patient visit. And then sometimes our health educator joins us. Patients are coached through all their care, their nutrition, their exercise, that we empower them to take care of their diabetes. Our patients receive follow-up as soon as every 2 to 3 days to get them into that diabetes control. And additionally, at the West Grace facility, a diabetes group education session is offered during the lunch hour for any patients enrolled in the program, and includes that healthy lunch. This is so vital for many patients who have food insecurity, and it many times it gives them opportunities to try new foods and to learn how to eat on a budget. Recently, the new food that was tried was hummus, and enjoyed by some, but not everybody. Examples of innovative diabetes classes include grocery store tours, lunch at McDonald's so people can learn how to eat out, and walks in the park. The diabetes classes are based on the ADCS curriculum, and each month we do it a little different. Each month is the same topic, but patients can come every week. Each week has a different focus, different activities that patients can engage with. And we have patients can come anytime. We have some patients who come every week. The size of the group is usually 2 to 10 people. And we've had over 200 people go through this program. And so when we think about this, not only does practicing your values relate to that healthcare team, but to our patients. And we build relationships with our patients every single day. It starts with Tanya Johnson at the MA station, who's been with us with Diabetes Impact Program for a long time. She knows the patients, they know her. She gets them checked in. She understands what's going on. And this is enforced through our outreach efforts in mobile medical and street medicine, meeting them where they are, connecting the dots, empowering them. During diabetes education class now, it's become a CGM download party with a friendly competition to see who's most in target or who's been most improved. And so more about patient relationships. Mrs. S was originally referred to Diabetes Impact Program in 2016 because of her uncontrolled diabetes. At that time, she had an A1C of 12.8, multiple health issues, and difficulty managing all of her medications. She was homeless and not checking her blood sugar. She started attending the weekly classes to help her on her diabetes journey. She was still working though with low health literacy and not always eating and mixing up her short and long acting insulin. She experienced a significant hypoglycemic episode. During that episode, her phone was stolen. It took us over a year to get her another phone. And unfortunately, it wasn't the phone she wanted because she was used to a flip phone. And so now she has a smartphone, and we continue every week giving her education to help her use that smartphone a little bit better. Fast forward, she now has a CGM. We were able to identify those significant hypoglycemia. Her medications have been deprescribed, simplifying her daily regimen, and still a regular attendee for diabetes group. I want to read a little bit about a quote that she wrote about her experience. I want to thank Dr. Goode and Leah for having this class to educate us on diabetes. This class has helped me on a lot of things I didn't know. Every class we have, I am learning more each time. I am blessed to be in this class to learn more about my diabetes. It is a deadly disease. People just don't know how deadly it is. I'm doing the things I need to do to stay alive, taking my medication, take my insulin, and eating the right foods, plus exercising my body. I feel so much better than I was. I will continue going to my classes to learn more and more each time. It's nothing to play with. I am serious about this disease. It's a silent killer. So we're blessed to see her every week, hugs and a big smile, and a patient with continued diabetes control. So when we move then from practice your values, it allows us to connect, to be flexible and open-minded. And then flexibility is really the capacity to change and to adapt to a challenging environment. It can be either adaptive when challenges are present in the environment, or spontaneous, a preference for change without any external pressure. A key to innovation is developing this open-mindedness. Being more open-minded means being flexible, open to different ideas, and building on the core value of inclusiveness. Dr. Cook joined just prior to the onset of the pandemic, bringing a vision and leadership to the organization that was unparalleled. Her leadership fostered the culture of open-mindedness and flexibility that allowed Daily Planet to adapt to a challenging environment to continue to care for our patients during COVID-19. She encouraged a team approach that enabled success to continue care of the patients, an all hands on deck approach. Imagine it's a cold, rainy day in January, and we are at the Healing Place, a substance use disorder program for homeless men to administer COVID-19 vaccines. Under a tent in the parking lot to decrease that spread of COVID-19, our newest staff member has just been hired, a psychiatrist. Well, without a patient panel, what's a doc to do? Give COVID-19 vaccines, of course. However, not a skill taught in psychiatry residency, but an opportunity for the pharmacist to teach our new psychiatrists how to give IM injections. Easy, right? Well, after a few snafus with different syringe mechanisms, he's become one of our biggest advocates for COVID-19, monkeypox, and influenza vaccine, administering vaccines during his patients' appointments. Flexible, of course, Dr. Cook talked about this. We proved that the breakfast room at the Days Inn would be a good place to give vaccines. Flexible, because Dr. Cook and I could step up and deliver, not wasting any COVID vaccines by spending the evening going from shelter to shelter to get rid of those last few precious doses. Daily Planet has also continued to change, even without additional external pressure, offering mobile and street medicine to our patients. There's the IV started on the side of the road. There's a ceftriaxone injection administered behind the building. That's being flexible and open-minded and what it takes to connect the final dot. Be brave and bold, do the impossible. If you were at the APHA annual meeting in March, you may remember Mick Ebling, who sees impossible as the word for something not yet done. Think like him and do the impossible. Daily Planet envisions a community where all are empowered to live healthy, enriched, and stable lives. Our superhero team does amazing things to make progress towards this vision. What they get accomplished is astonishing. There's the homeless man who needs access to breathe for incontinence. Staff, actually Tanya Johnson, worked for days to get through all the red tape. Dignity, no more living in wet pants. There's the extremely sick man with HIV who recuperated our medical respite to become a new man, then come to clinic weekly for support and medication box filling to verify that he was able to take his life-saving medications. Another example of our weekly care and accountability checks and support is the patient with type 1 diabetes who needs help with accountability or he won't take his insulin, and the patient who's trying to quit smoking and wants weekly help, all connecting the dots. So when Daily Planet agreed to connect the dots by helping the health department provide care for over 200 Afghanistan refugees, impossible? How will it work? Many had never taken care of children, but our team stepped up and were brave and bold. They received training, provided health care, administered vaccines, actually complex vaccine regimens, right? These children were coming in and had never been vaccinated or may have had one or two, complicated by large families and working through interpreters. We administer a record 58 childhood vaccines in one day. Daily Planet strong. And then there are the goats. Let's learn about our 46-year-old female patient with no health insurance. She has significant stress in her life. She has 2 children with special needs and then trying to take care of her other child, further complicated by marital issues with a spouse with a substance use disorder. Essentially, she functions as a single mom with limited ability to leave her home due to childcare. She was mostly accessing care through telehealth or televisits to control her diabetes. She was referred in July of 21 to Diabetes Impact. She couldn't take metformin. She had been started on insulin, had been titrated up, on Victoza, had been titrated up, wasn't working. We got her on insulin. She was using our 340B to get her medications, which was still even a struggle. And she was dealing with having highs at 200s and fasting at 300s after meals, and dealing with stress and anger, and she requested a support goat. So you can imagine Dr. Cook's face when I went to her and said, will you write a prescription for a support goat? It was a first. but we were able to facilitate the letter and the prescription for the support goat in November 2021. She received 2 goats, was absolutely elated, now expanded to 3 goats, meet Milo, Stormy, and Spotty. Her A1C decreased to 6.3. Remember, do the impossible. As we mentioned previously, so many dots to connect. Build on what you do day in and day out. Raise your hand, practice your values, be flexible and open-minded, be brave and bold, and do the impossible. Because the magic of connecting dots is that once you learn the techniques, the dots can change, but you'll still be good at connecting them. We will leave you with what is Pharmacist Services Innovation, those other dots, the ones others miss, and having the certainty to know that the dots you see are not only valid, but necessary if you are to connect the dots for those in need.
And I want to give a final shout out to the team members that we have here today. You guys got to see them all when we got the award. But especially because, like I said, I didn't type the text for all of this. Dr. Goode did, and she left out some of her own horn tooting. I know that most of you in this room have a prior relationship with her or know about a lot of her skills and talents, but I get the pleasure of coming to work at least 2 days a week and meeting up with her at 7:30 in the parking lot and hearing some of my favorite phrases from her. What if we should try, maybe we could write that up. And I've got a student that can do that. All of those things. She is bold, she is innovative, and she raises her hand. And we are very grateful to have her as part of our Daily Planet team. And we're grateful for all of our team of superheroes and the leadership that our executive team provides and allows us to be nimble and to be innovative in the way that we can connect the dots for people in need. Thank you.
Thank you so much. That was a great, give them another round of applause. We're going to open it up for a question. If you have a question, please raise your hand. Mitch, do we have the microphone? There, Jason has it. Okay.
What an awesome and powerful presentation. Thank you for the points. I was just picturing how to package that, all the points you gave so it could be shared across the nation. 2 questions. One is, what's the code you use for the goats? And
it was less that we needed help paying for the goats, is that we needed a landlord that would say it was okay to have the goats.
well, that could save them on the lawn cutting, expense.
Yes.
The second question is, we've got a wide audience, not just here, but across the nation that are listening to this. In developing that relationship that you have among the team members, we still face a lot of resistance from physicians and other team members in terms of engaging the pharmacists actively in the team. Any pointers, if you had to give 3 pointers, 3 pearls of wisdom on how to develop that relationship and trust, what would be your guidance to your colleagues?
I think, she says that's mine. I think face-to-face time is the most important thing in any relationship, right? So that's true with patients and it's true with colleagues. That time to sit down and learn what each other's gifts are. And I can tell you in our provider team, between the education opportunities where we'll have a provider meeting and Kelly or one of her residents will come in and present to us about, this is the latest standard of care for this, or this is the new Prevnar recommendations, the new pneumococcal recommendations that are out there. That builds trust in the providers. And then the day-to-day support of, hey, this isn't, providers constantly get beaten down with, this isn't on the formulary. You can't get this, you can't get that. And having that pharmacist to turn to say, what can I do? And having them answer correctly a couple of times, and that trust is right there. So I think it's that face-to-face and that presence in the clinic. I can tell you I've worked in other situations. Like I said, I trained in a place that had pharmacists as part of our inpatient teams. But in private practice, we didn't have that support. And when you try to do it without one for a while, and you start to feel like the person in the pharmacy is the one who's always telling you no, that does add to that gulf between providers and pharmacists. But when you're together in the clinic in that different role where you're consultative and you're working together for the needs of the patient, you feel that collegiality. So I don't know how to get more of you into clinic and out of pharmacies.
We have one individual online. Sabrina Wyatt, I've unmuted your line. You may have to unmute on your end. And there's 4 other questions online as well. Let's see. Looks like Sabrina is still muted. I'll read out 2 of the first 4, and then I'll go to the second 2. Some of them are operational, it sounds like here. Oh, go ahead, Sabrina. Are you unmuted?
Yes, I am.
We can hear you.
I was responding to something, writing that appeared on the screen saying, who can see this transcript when I raise my hand.
All right.
So
Thank
I
you
don't
for
have a
confirming.
question.
Okay, great.
Thank you.
Well, thank you for attending today. So the first of the 2 questions here, are your services provided only to your state via enrollment? And how many people does it take to provide and coordinate these services?
So I'm trying to understand the first part of that question. All right, let's say it again.
Are your services provided only to your state via enrollment?
So we are a federally qualified healthcare center. So we do have a service area that's defined by HRSA, which is kind of the Richmond area and the surrounding counties. For those of you that are familiar, kind of halfway to Williamsburg. So that catchment area, anybody can walk in from that catchment area. Now, because we are a special populations grantee focusing on homeless, those are the only people that we are accepting as new patients. You have to meet that definition of homeless.
Okay. And then it was, how many people does it take to provide and coordinate your services?
So we have 9 medical providers, 18 behavioral health providers, and that's a mix of psychiatrists and counselors, 4 dentists. We have a team of dental assistants to go with them, a team of medical assistants to go with our providers and our pharmacy crew. And then we have case managers, and that number varies depending on grant funding for case managers and outreach workers. All total, our agency has about 146 employees, but that also includes our 2 residential areas that we man 24/7. So each of them have a team of employees there.
And the next 2 questions may require some follow-up, but what's the common ratio of healthcare workers to patients for your programs? And the second one is, how much is the estimated cost to get the amazing results that you've accomplished with, quote, connecting the dots?
So that it is costly. There's no doubt about that. We really appreciate this pharmacy connection with VCU because that gives us some below market value labor. We also have students and residents who rotate through from VCU, which is a great source of expanding our human resources. We rely on our federal funding, but that's only about 1/4 of our budget. We rely on our program income from Medicaid and the enhanced reimbursement rates. We rely on some programming, a little bit now from 340B, which will hopefully grow as we get a pharmacy in-house, and then private foundations and private donors. As far as number of providers to patient, that's an excellent question. I think in the healthcare team, I would say you have 1 primary care provider, and I would give you at least 1/4 of a provider at the open access clinic because a lot of our patients really just come to open access clinic over and over again because they can't schedule and show up for an appointment ahead of time because they're too busy figuring out where they're going to be that day. And then we have an MA for every provider. We have one health educator for the whole agency. We have pharmacy team, 1, 2 plus residents for the whole team.
We have a little extra time for additional questions. So anyone?
I'm a real senior citizen these days. And I want to talk to all of you women about the fact that you talk too fast and you talk too softly. And I, at best, am just hearing one every other word. With some of you, I don't hear a damn thing. And if I don't hear you, you can give me the best information in the world and it's not going to do a damn bit of good. You really need to work on speaking slowly and clearly.
Dr. Goode and I have both been accused of
And
speaking
I
too quickly many times. So I take that criticism to heart because we both know that's one of our faults.
I can't tell you how happy I am to see all these women's faces. You have no idea how hard we work to see you here.
And thank you. Got it.
Do we have any guests in the back room in the overflow that have questions? Anyone? Okay, here's a question, Jason.
I want to say absolutely congratulations to the ladies. I'm so proud of you all. It's just so good to see women power. Yes. My question is, how do you extend when you try to get your patients to exercise? I've got an offer for you all. Because I work at the Y, we would love to do something with you all. I do aquatics. I teach Zumba. So we'd love to have some of your patients to come. And they have great programs. That's an offer.
Thank you.
Thank you.
All right. Thank you all.
Thank you. Thank you, Patricia. Thank you, Kelly, for your outstanding lecture. Your work with the Daily Planet Health Services is inspiring to pharmacists across the country. And I want to let you know it's personal for me and inspiring to me, as my grandmother passed away with diabetes, my father passed away with diabetes. All of my siblings have diabetes. And this is a very passionate area for me because we're, it's family. It's in our family. So I'm very, very proud and pleased of what you're doing for the homeless community and for communities of color. I thank you.